NHS services in England as part of efficiency plans seen by the BBC. The Chief Executive of the NHS Federation, Dalton, said growing demand within the NHS meant change was needed.
Well, there's a lot of emphasis on closures and cuts and such like, but in fact what we're trying to do is that we are trying to accept that there is a growth of demand on services, and with that demand comes rising costs, and we're not trying to say, well, the simple answer is to just slash and burn and close services, but in fact we need to think about how we deliver services and what tends to drive up those costs. So one of the things that we need to focus on is the role of social care, for example, and how that impacts on the NHS.
Well, with us now is Andrew McCracken from National Voices, which is a coalition of health and care charities in England. Thanks so much for coming in to talk to us. Do you agree, first of all, with NHS England that the reorganisation of local services is essential to improve patient care?
It is needed. The system and the way it's set up now, it's an old model that was built around treating disease. The idea was you got sick, you went in, you got fixed, you went home. That's not the system anymore. People are living a lot longer and they're living with long-term conditions. They might have asthma or dementia or cancer and they need ongoing treatments. And the system isn't set up. But the key thing to remember here is that these changes need to be made, but they need to be made in collaboration, in partnership with the local communities in that area. And that's the concern we have about the analysis we've seen today.
So your worry is that there hasn't been both enough transparency or indeed consultation?
The change needs to happen, but you need to do that with the people who are going to then use these services. People with long-term conditions are in and out of NHS and social care services. They're experts. They know what it feels like. They are the people you should be designing this with. It shouldn't be a plan that is published and is a surprise to the community. They should have been involved in developing it, and that adds greater legitimacy to that plan.
Given we are where we are, though, my understanding is that the public will be consulted in October. Too little, too late? Is that your view, then?
People need to be engaged right from the start. It's not about presenting a consultation for feedback. It's about having people there at the very start to make the decisions about what matters to them. It might be difficult if you're an NHS or social care manager to know and understand what it actually feels like to be that patient. It just seems really logical to me that you would get those people involved right from the start.
If these cuts go through, do you think the service will be affected detrimentally?
Like I said, I think the changes need to happen, but the driver needs to not just be about money, it needs to be about the quality of care for people. Again, that's why you would involve them right from the start. And these plans are called sustainability and transformation plans. Yes, there's an element of sustainability, but let's not forget about the transformation and the positive change.
We've been focusing mainly on hospitals, but what about social care? Is that being listened to in the process, do you think? It's
an excellent point. There are some major issues going on in social care at the moment. It's severely underfunded and receives a lot less attention than the NHS. As I said earlier on, people are living a lot longer with long-term conditions. That means that you may go into hospital for treatment in a specific way, but then you may need social care service outside of it. If those services aren't there, then that's going to cause a real issue for you. And that's why, actually, we do need some change. And this process could be a good thing. We just need to make it more open, more transparent, and involve the local people and communities.
Is it fundamentally a question, do you think, about there not being enough money? Or is it that there is now simply just too much demand? What is the actual root of the problem?
Certainly on the social care side, there is the need for increased funding, and you could argue that elements of the NHS do need more money, but if we just keep on ploughing money into a current system as it is, it'll be a bottomless pit which will just keep sucking up more and more resources because it's not set up in the right way to treat the sort of illnesses that we have today in 2016.
OK, Andrew McCracken from National Voices, we must leave it there. Good to talk to you. Thanks.